Welcome to Burlap Teachers. Enjoy the video.
In this video, I will explain how to use oxygen for patients. Begin by confirming the physician's order, verifying flow rate, and choosing the correct delivery device. Always inspect tubing and interfaces for kinks or damage and ensure connections are secure. Position patients comfortably and educate them about oxygen safety, including no smoking and keeping oxygen at a safe distance from heat sources. Monitor oxygen saturation and adjust care based on clinical signs and orders. Choose the right device by matching patient needs to oxygen delivery characteristics, starting with nasal cannula for low flows and masks for higher demands. Assess whether humidification is needed to prevent mucosal drying, especially above 4 L per minute. Ensure proper sizing and fit to minimize leaks and maximize comfort. Teach patients how to use and replace disposables, and double-check that flow meters and regulators are set to the prescribed values before leaving the bedside. Monitor patients continuously using pulse oximetry and regular clinical checks for breathing effort and mental status. Be alert for CO2 retention in vulnerable patients, and report rises in respiration rate or confusion. Troubleshoot by checking connections, flow settings, and device function if saturation drops or alarms sound. Replace disposable components when soiled or damaged, and always document changes, responses to adjustments, and communication with the prescribing clinician for continuity of care.
Thanks for watching. Consider subscribing if this video helped you.